Thank you all for joining us today. On behalf of SAGE's National Resource Center on LGBTQ plus aging, welcome to today's webinar, From Planning to Action, highlights from LGBTQ plus area agencies on aging. My name is Cheryl Wayland. I use she, they pronouns, and I'm the Director of Special Initiatives at SAGE. Before we get started today, I'll go over a few housekeeping items. This webinar is being recorded and a link will be shared with you in a follow-up email. Captioning is also available by turning on the captions with the CC button or through the More option at the bottom of your screen. We will also have time at the end of the panel discussion for today's Q&A. We invite you to submit your questions by using the Q&A tab at the bottom of your screen, and these can be submitted at any time throughout the webinar. And if you have any technical questions or need support, please send a message in chat and someone will assist you. The National Resource Center on LGBTQ plus aging is supported in part by the Administration for Community Living, ACL, U.S. Department of Health and Human Services. The information, comments, and discussions during this webinar do not necessarily represent the official views of, nor are an endorsement by the Administration for Community Living. SAGE and the National Resource Center is grateful for the support of ACL and the relationships we have developed with the Aging Network as we work with you to improve the quality of services and supports offered to older LGBTQ plus people across the country. We have people represented here from all across the country today. We had nearly 1,000 people register for this webinar, and we will be making sure that a recording is available for those who weren't able to join us. It is now my pleasure to welcome Michael Adams, SAGE Chief Executive Officer.
Thank you, Cheryl. And it's really my honor to be with you all today as we get started. For decades, older LGBTQ plus people in need of everyday services like caregiver support, home delivered meals, and transportation have delayed seeking the support they need or avoided it altogether out of fear of discrimination from aging networks that have historically been seen and too often experienced as unwelcoming. With the 2020 reauthorization of the Older Americans Act, efforts are now underway to ensure the Aging Network is in fact welcoming to LGBTQ plus older people and caregivers. And I think we can certainly see the energy and positive progress around that and the high numbers of folks who signed up for today's program. The SAGE National Resource Center on LGBTQ plus aging has been working alongside state units on aging, area agencies on aging, and disability resource centers since 2010 to provide technical assistance and training in support of LGBTQ plus inclusivity. The resulting partnerships built over the years have been instrumental in growing an LGBTQ plus welcoming aging network. Today's webinar is but one example of the work we are doing at SAGE to support your efforts to develop and implement state and area plans inclusive of LGBTQ plus older adults and older adults living with HIV. We are so excited to engage in today's conversation with so many of you. Now it is my honor to welcome Edwin Walker, Deputy Assistant Secretary for Aging with the Administration for Community Living. We're deeply grateful for the wise and steadfast leadership that Edwin provides at ACL. Edwin consistently advocates on behalf of all older Americans aging with dignity and independence by his support for the continual and equitable expansion of opportunities through the Aging Network for enhanced quality of life for our community's older people. Edwin, thank you for joining us today to share your thoughts on the importance of an inclusive, LGBTQ inclusive aging network. Thank you so much. Edwin, I'll pass it over to you.
Thank you, Michael, and it is clearly my pleasure to be here today. Thanks to you, thanks to SAGE for all that you do. You are an outstanding organization and one of our premier national resource centers. We are just so pleased to have you as partners and providers of technical assistance related to LGBTQIA+ older individuals and the wide range of issues encountered. I am very pleased to join you today for this webinar, which is both timely and of critical importance. Thanks for convening it and for pulling together today's very impressive panel to focus on successful planning strategies and actions that AAAs can take to create welcoming and inclusive aging services. But let me begin by sort of setting a little of the framework. As you mentioned, I work at the Administration on Aging, that component of the Administration for Community Living. And we focus on implementing the Older Americans Act. And in doing so, we develop the guidance for states and area agencies on aging to fulfill their mission of developing a comprehensive and coordinated service delivery system. So we are working to improve services and supports for LGBTQ+ older individuals in a couple of different ways. First, we've already begun evaluating our aging network to see where we have strengths and where there are opportunities for program improvement and where to target interventions in the coming years. Second, we're supporting our current grantees, like you, to focus on minority populations and those with historically limited or no access to services and supports. You and the other National Minority Resource Centers in our Older Adult Equity Collaborative provide critical technical assistance to the Aging Network to ensure that our services are developed and delivered with cultural sensitivity and that they're really tailored to the unique needs of each population. Our LGBT Resource Center at SAGE is so well recognized as a national leader in issues of aging, diversity, equity, inclusion, advocacy, and technical assistance. In addition, following the reauthorization, as Michael mentioned, of the Older Americans Act in 2020, we developed and issued state plan guidance in 2021. This guidance provides updated recommendations for continued inclusion and advanced support around equity in state plans. As you all know, the Older Americans Act programs have for quite some time required funding to be targeted to those in greatest social need. This guidance is in line with the Biden-Harris administration's executive order advancing racial equity and support for underserved communities. We've highlighted older LGBT+ people as a focus or target population in our most recent state plan guidance. And what that means is, as states develop their plans on aging, which are essentially a multi-year blueprint for aging services in a state, they will include information on how to plan to serve older LGBTQ+ adults. And we, through forums like today, will continue to assist states in the development of their state plans. So as area agencies and state units on aging develop their area plans and state plans, we at the Administration for Community Living encourage them to take a broad approach to ensuring services are reaching older adults in greatest social need. We've clarified that these populations include individuals who are Black, Latino, and Indigenous Native American persons, Asian Americans and Pacific Islanders, and other persons of color. They are members of religious minorities, lesbian, gay, bisexual, transgender, and queer persons, persons with disabilities, persons who live in rural areas, and those at risk of institutionalization. And I want to stress the importance of writing area plans that reflect this guidance in support of state plans that truly are inclusive of serving the needs of LGBTQ+ and older individuals living with HIV. That also plans that are inclusive of impacting the social determinants of health of older individuals, providing cultural considerations in service delivery, and supporting participant-directed or person-centered planning for older adults. Lastly, I want to remind all AAAs and the SAGE National Resource Center on LGBTQ+ Aging that you have a number of resources and best practice guides and fact sheets and recorded webinars that you can use to assist the Aging Network as they make their programs LGBTQ plus welcoming. And mostly, I want to stress that this really can be done. Very recently, I heard of how some states and area agencies in certain parts of the country are struggling with what and how to implement the provisions in the state plan guidance. In fact, we heard that some didn't think that they had any LGBTQ plus older individuals in their service area, and therefore they didn't need to do anything. Well, I'm not really going to comment on that one, but SAGE and webinars like this are designed to help provide the know-how. So I encourage all of you to encourage your peers, encourage them to conduct broad public input for answers as well. Through such efforts, I'm confident that they will find that they have plenty of LGBTQ plus older individuals. So Michael, thanks again for today's incredible effort, but for all the many, many efforts of SAGE on behalf of LGBTQ plus older individuals. And now back to up to our panel. Thank you.
Edwin and Michael, thank you so much for joining us today and sharing of your time. And Edwin, I'll just say that yes, communities large and small across the country are serving LGBTQ plus older adults. We're oftentimes invisible, and we want to stop that invisibility and make sure that we really are, reaching out and supporting folks that are in our communities today. So thank you both for being here with us today. And we will now start to introduce our panel. It's really important that each of you are here with us today, because you really are the partners that we need to be a part of the work that we're doing to support LGBTQ plus older adults who are our neighbors and our friends. And that brings us to our main event, which is our panel discussion. Joining us today, we have Emma Becerra, Manager of Civic Engagement at SAGE, coming from the great state of New York. We have Jason Eccles, Manager of Special Initiatives at Age Options, joining us from the great state of Illinois. Jennifer Horn, Family Care Support Center Care Planner at Pikes Peak Area Council of Governments from the great state of Colorado. Katie Kutcher, Assistant Aging Director at Centralina Area Agency on Aging from the great state of North Carolina. And Lisa Knoll, Chief Executive Officer, Aging Ahead from the great state of Missouri. Thank you all for joining us today. As we start this panel discussion, I'd love to ask Emma to start us off. Emma, could you share how you are engaging with area agencies on aging as they develop LGBTQ plus inclusive plans?
Yeah, of course. And thank you all for being here and joining us in this very important webinar. And thanks for the question, Cheryl. I think first and foremost, what we're really working on in the through line of a lot of this webinar and this work is demystifying the idea of LGBTQ inclusion and offering tools to help you make it happen. Really, we want to highlight how possible this work is, and even without the dedicated budget or staff, people can do this work across the country. People are doing this work across the country. So I want to briefly touch upon some kind of high-level issues that we deal with in the area of LGBTQ plus aging, just to set the ground floor at understanding what it's like to age as an LGBTQ plus person. So first of all, LGBTQ elders have experienced a lifetime of discrimination in healthcare and employment and housing, all areas of life. And it makes us very hesitant to reach out to mainstream services and supports, as we've kind of already heard. 1 in 3 LGBTQ plus older adults actually lives at or below the federal poverty line, and that number only increases when we factor in things like race and gender identity. Nearly 50% of transgender older adults live at or below the federal poverty line. It's about 40% of Black LGBTQ plus older adults and about 40% 40% of Latinx and Hispanic LGBTQ plus older adults live at or below the federal poverty line. And we're also less likely to be married, and we're less likely to have children. So it means that maybe we're estranged from our families of origin. We rely on networks of care within age peer groups who are not always, physically or mentally able to care for each other as, children might be. And it means that LGBTQ plus older adults are really much less likely to have caregivers within their family as their straight counterparts. And, as we talked earlier, really are in need of supportive services that they may be less likely to reach out to. And kind of touching upon something that Edwin was talking about, there's really a lot of opportunity for this work to be done due to updates in the most recent authorization of the OAA, and then all of the great guidance that ACL has distributed since then. And we'll share more information that kind of outlines all of this. So that you don't have to write everything down or anything. But for those who are unaware, the OAA now requires a few things of the Aging Network. It requires that we collect data to determine the services that are needed by older individuals whose needs were the focus of all centers funded under subchapter 4 in fiscal year 2019. So what that convoluted language means is the key part is all centers funded in FY 2019, and that includes the National Resource Center on LGBTQ Aging that we've been talking about. So that means we have to collect data on the needs of LGBTQ plus older adults. It also means that we have to collect data to determine the effectiveness of programs and policies and services provided by the Aging Network, and engage in outreach efforts as well as other activities, really to satisfy the assurances and what the OAA is supposed to do for LGBTQ plus older adults. Now, to answer your question, Cheryl, to go back to that, the assistance that SAGE has been offering is pretty wide in scope, since every state and AAA is so different, as you all know. If you're looking for folks to serve on an advisory council and you want more LGBTQ plus representation, we have a group of volunteers that may be in your area and groups that we partner with that we can connect you to help recruit for advisory councils. These folks can also join community listening sessions and, other opportunities for feedback. LGBTQ plus older adults themselves are really our best resource on LGBTQ plus aging needs. And it's just a matter of reaching them. So how do we reach them? We're going to hear a lot about strategies today. But like Cheryl was saying, you're probably already serving us. Wherever you're doing outreach, make sure your materials are inclusive, because we are there. We and our families are everywhere in every part of the country. So every place you go is really an opportunity to provide outreach to LGBTQ plus folks. So it's about being proactive and also reactive. Are you attending Pride festivals? And are the materials that you're bringing to things like health fairs and outreach events, do they have same-sex couples and trans people represented in your materials? What does the intake process look like? How can we make sure that people feel comfortable sharing information like gender identity and sexual orientation, and they know that it's confidential? And, like I said, if you don't have the skills or experience to do this, we can help there too. SAGE provides free of cost training to AAAs on how to collect sexual orientation and gender identity data, on how to be an ally to transgender older adults, and also just on basic LGBTQ plus aging 101, as well as many other topics. And like I said, it's free of cost to the Aging Network. And we'll share more information about these cultural competency trainings and how to access them after the webinar so folks can take advantage. But I just wanted to make sure that we could really highlight that resource, because it's something that a lot of AAAs and state units have taken advantage of, and we always want more folks to take advantage of those trainings. And then just as a caveat too, there's always this idea that we have to maybe start off new LGBTQ programming, and maybe that's not always the best way. Maybe the LGBTQ folks in your community don't want to go to an LGBTQ specific programming event. But if you do want to start your own programming, if you feel like there's a need, and in the data that you collect on their needs, something comes forward that says, we need more social time, we need more friendly caller programs, things like that, then, it's always good to reach out to your local LGBTQ center, a local organization, to co-host an LGBTQ plus friendly caller program. SAGE has a friendly caller program. Many other AAAs and many other LGBTQ organizations have them. Maybe an LGBTQ monthly meal service. I know that there's one out of California and one in Rhode Island that has a monthly LGBTQ meal service. There's also in-person friendly visitor program, LGBTQ caregiver support groups. There are a whole host of ideas that people have really been working on. And again, a lot of these resources and the lessons that people have learned is really it's all on the National Resource Center for LGBTQ Aging. So again, we'll share that with you. And I think also by partnering with LGBTQ plus older adults, we can always, it's a way to mark your organization as one that's safe to go to. You have that marker from another LGBTQ organization that says, oh, okay, I know that I'm going to be accepted at this not LGBTQ specific part of the organization. And just to wrap up, again, highlighting that we're here for a resource. On the technical side of things, we can also help. We've been providing technical assistance to states like Arizona, North Carolina, Ohio. I saw some familiar names on the call with folks that we're working with to help you draft your state plans, help you make sure they're in line with the federal law and the guidance. We can share sample language, we can redline and edit and things like that. We're really here for you as a resource. And if you're interested in one of those resources, you can reach out to advocacy@sageusa.org, which will go to me to get started. You can also visit our website, like we said, the National Resource Center on LGBTQ Aging. We're going to share a lot of specific resources, and I want to make sure that they don't get lost in the shuffle. And if you're interested in joining our email list that's specifically around advocacy and how we can make our services more inclusive, I'm going to drop a link in the chat. Oh, you know what? It's not letting me drop the link in the chat, but I'm going to put it there and hope that one of my co-hosts can drop that link to go to everybody. But I just put a link in the chat for you all to join our email list to stay in touch. And like I said, you can always reach out to advocacy@sageusa.org to get started.
Thank you, Emma. And I think you had the first question for our panelists.
Yeah, I do. So now that we've chatted about how SAGE can help, I really want to turn it over to our panel to hear more about the work that they're doing in the states. Jason, I wonder if you could get us started with telling us a little bit about how your organization is working to meet the needs of LGBTQ plus older adults in your community.
Thanks, Emma. And before I do, I appreciate being here. And I saw so many Illinois folks in the panel. So I just want to shout out my colleagues here in Illinois who are doing so many wonderful things at their AAAs. And we're very lucky in Illinois to have a Department on Aging that's very supportive of the work we're doing and have some really fascinating and thoughtful people throughout the state. So just want to shout that out. But here at Age Options, we're the Area Agency on Aging for suburban Cook County. So Cook County, Chicago has their own AAA. We're the suburban part of it. And one thing we often talk about is that you think the concept is that all older LGBT plus people are in big major cities, and it's just not true. There's an AARP study that talks about 26% of LGBT older adults live in suburbs of major cities and another 25% in smaller rural communities. So as you all were introducing, there are older LGBT people everywhere. So here at Age Options, one of the things we've done is around our LGBT plus initiatives, we have a special program here called Thrive with Pride. And Thrive with Pride is a monthly event. Right now they're online and they're virtual. Anyone can join. Emma is even joined as one of our guest speakers around advocacy. So we're so grateful for Emma joining us for that. But we host just an online virtual kind of learn some information. And at the core of it, it's about building community, building connections among people, saying I'm not alone, learning about other resources. And then we partnered with people throughout our area to host kind of follow-up cafes, we're calling them. What's been interesting is we started this right at the beginning of 2020, and well, what happened? COVID happened. So we were planning this as an entirely in-person program, but we had to switch pretty quickly to being virtual. But if you'd like to know more about this, we do have a website, thrivingwithpride.org, where we've archived a lot of things. A lot of our monthly events, videos, resources, etc. And I would say the thing that we learned from that was just, well, our plans had to go south, as everybody did in COVID, and you had to think of something new. And you can find some interesting creative things from just trying something new. So thank you for the opportunity to share, Emma.
Yeah, thanks for sharing. And I love Thrive with Pride. Love that I was able to join from afar. Jennifer, could you tell us a little bit about your work in Colorado Springs?
Yeah, thanks for having me. I'm Jennifer. I work in Colorado Springs, Colorado. I live in Pueblo. And so I'm kind of bouncing between partnering with the Pueblo Area Agency on Aging, which I did see was on here in the call. So that's good because we're working on trying to see what part of the communities are more willing or open and ready to kind of come out of the closet to seek out those services. Because one of my big concerns is asking an older LGBT adult to come out, but not have that support system set up for them. And, you know, in the news in November, Colorado Springs was in the news for a big shooting, you know, for one of our local gay clubs. So that kind of put us kind of, again, up on this pedestal of like, what are we doing for the community? What can we do to support the community? And what I am happy and proud of my agency is that we are in the talks of having more community conversations with LGBTQ individuals and older adults. And we've updated our intake forms to collect that data on sexual orientation and gender identity. And what I've noticed in the caregiver support program is, because it's on our intake form, it does offer a little bit of an opportunity to educate as well, because we do get those people who come in and ask, well, why do I need to answer this? Why do you need to know this? Why is it so important? It doesn't matter. We're all human. We're all this, we're all that. I understand it, but it's also a good avenue to educate and explain the reasoning behind collecting the data, why it's important for us to do that research. So what we're looking at is how in our four-year area plan, how can we be more inclusive and be more open to the community, so the community knows that they are more welcomed and we have those resources. So a lot of ours is on education, outreach, and working with the family caregivers as an in to the communities.
And I'll jump in next. This is so wonderful to hear everything that everyone's doing. I'm Katie Kutcher. I'm with the Central Carolina Area Agency on Aging. And so I'm in North Carolina. And I'll just share a little bit about Central Carolina. We cover 9 counties in central North Carolina, so around the Charlotte, North Carolina area. And so like many area agencies on aging, we're involved with a variety of different aging services. On the one hand, administratively, so we work with a network of wonderful providers throughout our 9 counties. And then we have some direct services as well. In terms of how we're working to create more inclusive services for the LGBTQ plus population, one thing is we're very committed to regular staff training. That's so important. And I think we're going to have a chance to talk more about that later. But in addition, so we have added some diversity and inclusion statements to our website. We've also reviewed and modified our brochures to make sure that they are more inclusive for the marketing that we're doing when we're out and about in the community, telling individuals what services that are available. And then one initiative that we're really excited about has been really focused on creating more inclusive long-term care communities across North Carolina. And we've been really excited to have a civil money penalty grant, a 3-year grant that has allowed us the opportunity to provide training to skilled nursing facilities across North Carolina about supporting LGBTQ plus residents in long-term care. And so that program is actually a train the trainer model. And that was developed in partnership with our Long-Term Care Ombudsman Association for the state of North Carolina. We also partnered with an organization called the Charlotte LGBTQ Elders to help us in the development of those materials. And again, the ombudsman were so essential in making sure that we were able to bring up in the training resident right considerations, which are so important. And then we've been able to partner with the North Carolina Association of Area Agencies on Aging to provide trainings across North Carolina to skilled nursing staff, to our long-term care ombudsman, as well as surveyors who can become trainers to then provide this training on an ongoing basis to the long-term care communities across the state. So we're really excited about that. And I'll hand things over. We'll keep it moving. I think, Lisa, I think you're next.
Hi, everybody. Yeah, I'm Lisa Knoll, and I am with Aging Ahead, and we are the AAA that serves the metropolitan St. Louis area, exclusive of the city. We have a partner AAA that is there. I'm so inspired to hear what everybody is doing, and have always felt that when I've gone to national conferences and have heard what some of our partner agencies here in Missouri are doing. And several years ago, I want to just take a minute to say, I appreciate that this webinar is from planning to action, because that's a process that we really were intentional about several years ago. And so hearing all the things that are going on, of course, we wanted to be that, do that. And it just, there were so many opportunities, but we had a hard time, honestly, figuring out where can we have the most impact and, you know, serve the most people. And so we took, and I'll just give a shout out to the National Resource Center. Edwin talked about it, Emma talked about it. There's wonderful tools there. One of them that we took advantage of is an assessment. It's actually a readiness review, I think is what it's officially called. And so we took the time, and we don't always get to do that in the AAA world. You know, I feel like I'm a planner by nature, but sometimes I feel like I'm flying by the seat of my pants, right? And so we wanted to really do this well, and so we were intentional, and we're trying to be a little more strategic. So we used that tool, and not to get into too much, you know, down the rabbit hole with the tool, but it's really cool if you haven't already looked at it, because it's broken into sections. So you can kind of take one chunk at a time and really take a look at what your agency is already doing, maybe some places that you want to grow, and then the resources that are associated with that particular focus area are part of the tool. So you can just take it a little bit at a time if that works best. But at that same time, we were sort of grappling with all of that. We had a pretty high profile housing discrimination issue that came up in our service area. It was pretty yucky. And I think it was even, you know, got national attention, but it caused us all the more to say, why aren't we doing more? Where do we start? It just honestly felt a little overwhelming. So to really kind of take it in pieces was something that we were intentional about. And two things that we looked at to start were, and we felt like were important, was to both build strong foundational support internally with our staff and boards, and then to also, and kind of at the same time, demonstrate public commitment to the process and to the goals that we were really trying to lay out. So Sage Care trainings have been mentioned. We required that all of our staff do the Sage Care trainings. And, you know, I'm not one to mandate things. I don't really like that to be the reason people do things. But I have to say, when we rang the bell and were able to say we had bronze level certification, our staff are super proud of that. And they're even asking, how can we get the silver certification? So, you know, that's a cool thing. And it was fun to see that happening. And then we're also being intentional about putting folks on our boards that are part of the LGBTQ community, our agency board, our silver haired, our advisory council. And what's interesting about that is, as we started to do that, we had more people from the community who wanted to join, because they recognized they really mean what they're saying. And so that's been a cool experience. And then demonstrating publicly, there's tons of ways that you can do this, and that we've chosen a couple. We have a website survey, and you know, that's an easy lift. It's high visibility, and it also kind of gets you out of that murky area of trying to figure out what unmet needs are, because we get real-time responses, and we've had quite a bit. People are very open about themselves, their situations, what they need. And so that's been super helpful, that data and feedback to inform our area plan. We've had LGBTQ specific focus groups that also are part of our area plan priority setting. And something I can't personally take credit for, but we're pretty proud of here in Missouri. We have a Missouri LGBT Older Adult Alliance that sort of bubbled up organically after several of us were talking informally after at a national conference and saying, what can we do to collaborate better? And so there were advocates, AAAs, community-based organizations, and state folks. And so we came together and we formed this alliance. We meet regularly, and it's just a way, and I know Jason mentioned this too, just a way to educate each other. And it's a real safe place, regardless of where you're at on that continuum. It's a real safe place, non-judging, where you can share resources, ask questions. And so it's been pretty eye-opening and great.
Thank you all so much for your remarks on our opening question. And, I think as we're starting to realize, including LGBTQ plus older people in our work and our outreach on our boards and advisory councils, it's not a one size fits all. And so, what could you all share with your colleagues who are here on the call today? One or two things that they can do to be inclusive, as they're starting to do this work. And Jennifer, would love to start with you.
Sure. I think there's a couple of options, really. I think one is really just kind of being open and honest about your own knowledge within the population group and taking that first step to kind of introduce yourself to the community and understand that, you're coming in as an ally, as an advocate, as a friend, someone who can help navigate some of the systems for that community if they're having difficulty, not coming in with a savior complex of I'm coming in to fix it, I'm going to make it right, I'm going to do this, and we're going to be great. Like, that's not the idea that you want to come in with it. So I think just coming in knowing, hey, I don't know everything, I'm here to learn, I want to know what it is from your community that you need from us, or what I could be doing better to benefit the community. As a part of the LGBT community, I go through my own little corners and avenues and, looking at different groups that are meeting. If they're open, if they have group times when they have allies that they welcome, go to the group gatherings when they want allies to be there, because they want to communicate, we want to talk, we want to see what you're doing in the community and how you can best work together. The other is, admitting the hard stuff, that there are racism, bias, and sexism and homophobia and transphobia all out there, and people are going to be uncomfortable with it, but knowing that it's okay to sit in that discomfort and know that we're going to be working through this together. I think those are two important things when you're doing this type of work, is knowing that you're going in there not knowing everything. You're not coming in with a savior complex or trying to fix something. What we're doing is, if we really want to meet this level of equity, we all have to come in there knowing that we aren't going to be able to solve it as one person, and we have to take in everybody's lived experiences with that.
I'd love to jump in if I could, just because
Please do.
I love what Jennifer said about just, working through things together and letting that be known and putting that intention out there. And that can be in a formal way. And again, I shout out to the Resource Center there. We used the materials to look at formal agency policies and board bylaws and things like that. Again, it kind of puts your money where your mouth is, but then there's also just those informal ways that we can let people know that we're intentional about this and we really do mean business. And it does take all of us to do. It's not a mandate from from the leadership or whatever. It's everybody in it together.
And I can jump in next. I think two recommendations that came to mind, and I talked with my team here to get their thoughts too. One is really emphasizing that continuing education and how important training is for your own team at the area agencies on aging, as well as then the other providers in the aging service network. And so we mentioned how important training is, and Cheryl, I think I saw you dropped in the chat box the resources for Sage Care, and I just can't say enough about what a wonderful resource that is for your area agency on aging to obtain training, and then really kind of reframing the way we think about training. Because it's not a one-time training, right? Oh, check it and it's done. It's really recognizing, like Jennifer said, we still have so much to learn and can continue to learn. And so really being dedicated to continuing ongoing training, I think is really important. And so Sage Care, again, can't say enough about how wonderful that resource is. So really encourage those who are interested in getting that training for your staff to look into that resource. And then another resource that we utilized at our area agency on aging was through an organization called Elder Source Institute, which is another area agency on aging in Florida, and they have a wonderful training program as well. So I just wanted to mention those. And then similar to what we've heard, just another recommendation is just partnering with your local LGBTQ plus organizations. as much and however you can, right? So it might be involving them to help when you're doing that, almost like that self-assessment, right? You're reviewing your own materials, your non-discrimination policy, your marketing materials, your intake forms, getting input. That's an opportunity. Making sure they're aware about volunteer opportunities, right? So that they can get involved with your organization or in a leadership capacity in an advisory board. And then finding out about their events that are happening. How can you as an area agency on aging support their ongoing events as well? That would be another recommendation. And I'll pass it over.
And so I second everything everybody said so far. But Sage, actually, really, y'all do provide so many great resources. And I was noticing some people talking, and I think it does kind of get people nervous about, how do I ask the questions? How do I ask about sexual orientation or gender identity? Guess what? Sage wrote the book on it. There you go. And I'm sure Cheryl will share the link, as they've been doing so far. But inclusive questions for older adults, it's great resources. So talk to the people at Sage for your specific questions too, to find the right resources. If you're not able to find them, they exist, they're there, and they're people who understand this. And, you know, I know asking the question is really hard for people. Because you get in your head about it. You're like, oh, is this like, can I ask this? How do I go? But I think we also all know there's been a time where people don't want to give us their zip code, and it's like, okay. I mean, people will get mad about what they'll get mad about, but it's, you know, it's okay. But like someone was saying before, what's more important is like what it signals to the community that, no, we're asking this question because it is important. Jennifer talking about the people coming in and seeing that question and what it means to folks. If I were to give a tip of where to start, I think it is like everyone's saying, Sage has done a wonderful job of providing a lot of resources. And I think too, it's if you're not doing this type of work of trying to think about all the people in your community, if you're serving everyone, then what you've got is programs that serve, well, it's probably you're imagining a world that's cishet and white, and that's not the world that we're living in. Cisgender and heterosexual. You know, the world isn't black and white, the world's technicolor, and like there's so many different people. When you start thinking about these things, when you start asking questions or framing it around people who are not cisgender or heterosexual, it opens up a world that helps people who are. Being able to ask a question instead of who's your spouse or who is, you know, your daughter, son, who are important people in your life, opens up a world for anybody to talk about what's important to them, and you know, goes beyond just seeing something as just this box. So I think just kind of thinking about that, that, you know, it's like the Wizard of Oz, and you open the door and you see the world as so many different things. That's what kind of thinking this way and thinking differently about this can do. So thank you.
I wanted to chime in on that as well, Jason, because it reminded me of when I was sitting on a dementia-friendly board just meeting, and I mentioned LGBT older adults and their caregivers and those with dementia, and I was asked, well, why do you have to put it in writing? Like, if people should know. Well, no, because I make the assumption if I'm not on there, you're not including me. You're not thinking about me. You're thinking about what is the status quo. And that's the important part of this whole thing is we want to dismantle the status quo. We want to reflect what we really do represent as a whole, which is a multitude, a variety of people and their experiences.
Can I add something sort of practical to both Jason and Jennifer's comment? And so that the survey that we started, and I can't remember, it was maybe a year or so ago on our website. Again, it was an easy lift. It's on the front of our website. And it's a great way for us to, because we haven't incorporated those assessment questions yet. We're still working on that. But this is a way for us to demonstrate there are people in our service area that have, you know, those needs. And so we have a couple of rural counties, and sometimes that's a stereotype, and as somebody mentioned, and so having that, getting that feedback from our website is demonstrative of, yes, we have work to do, and there are people that need more than maybe what we're currently doing.
Thank you all for this wonderful conversation. Are there any other thoughts that you haven't been able to share with yet that you would like to share prior to us going into our Q&A? Yes, Jennifer.
I just want to make a quick plug for Zami Noblev because I wasn't familiar with the National Organization of Black Lesbians on Aging. So if you do know of lesbians of color who are not necessarily comfortable going to SAGE for various reasons, shoot them over to Zami Noblev. That is a great small organization based in Atlanta, but they do amazing work as well. So then there's another one in Kansas called Owlish in Omaha, or I'm sorry, Nebraska, Omaha, Nebraska, Owlish. So there's lots of little places. We just have to dig and make those connections so that we can provide that support to our communities.
Thank you so much for that, Jennifer. And Jennifer, could you drop that link in the chat for folks so they have it?
I can put it in there, but I believe it only has me going to hosts and panelists. So I believe someone else will have to.
I just sent it to Nicole and it will get there.
Okay,
Yay,
there
thank you,
we
Nicole.
go. Have it. This is why we need multiple people helping us run a Zoom. And I just want to say that this is one of the largest webinars I've been a part of here at SAGE. At one point, I think we had over 650 people who had joined us. So thank you all. And again, this is being recorded, so it'll be able to be shared with colleagues that may not have been able to join us today. We do want to now start with our Q&A. And I would just like to pull up one of the questions here. I believe, let's see, I think it ended up in our answered section already. But one of the first questions that came in was, our staff may be feeling insecure about asking questions related to someone being transgender or gender nonconforming, as well as sexual orientation that's now required by this person's state. Do any of our panelists have suggestions on how you can help support your staff to be more comfortable in asking these questions? Jennifer?
Yeah, so because I know that is uncomfortable for people, especially if it's not necessarily something that you do every day, or you know, when you introduce yourself, you don't necessarily, we used to not always present our pronouns. So I always tell people, use this conversational pieces, right? So in our intake form, we have gender identity, and I have, you know, female, male, non-gender conforming, not written or not listed, you know, give them that option. But then I also tell people, you know, your client, especially if you've already had some type of rapport with them, just ask them how they would like to be called, what they would like to be called. What is it that you, I don't like to say preference because it's not a preference, you know, like my gender pronouns are not a preference. That is who I am. Therefore, when you just ask the person, how would you like me to refer to you as? What is it that you would like to be called? You know, sometimes just saying this is uncomfortable for both of us. This is new. This is something that we haven't typically always collected data on, but we're trying to do better. And the way that we can do better is by asking those questions. And, you know, again, sitting in that discomfort and knowing that even though you're uncomfortable and that person's uncomfortable, it still opens up a little bit of a window and plants a seed for people to kind of ask more questions as to why we're doing these things.
I think the other thing that I'll add there too, just to jump in super fast, is that I think the other thing is being really clear about why you're collecting that data and where the data is going to be stored and is it confidential, because LGBTQ folks are very hesitant about people collecting data about us. We're like, what are you going to do with it? Are you asking me so that you can deny me care? Because that's what happened in the past. So I think being very clear about the purposes of the data collection and saying this is completely confidential. It's disaggregated from your name. So it'll become, you know, all of the data confidentiality, being really clear about that.
Thank you so much, Jennifer and Emma. You know, I'd like to also add that through the National Resource Center and some of our work with AAAs, this was actually with a group of area agencies on aging in California. We actually developed a role-playing guide so that you can take this guide and use it with staff to help them become more comfortable in asking these questions. And we also worked with the area agencies on aging to develop a handout that you can share with older adults, you know, so that they have information about why we're asking these questions and why it's important. And, you know, the main reason that I share with folks is, you know, we ask these questions so people feel that they're being seen and heard, and so that they have an opportunity to, make sure that their needs are being recognized and supported by the area agencies on aging. And I think that leads us to our next question. And Emma, feel free to jump in on this one as well as the panelists. This person asks if we could talk a little bit about programming and/or initiatives that SAGE is prioritizing for LGBTQ plus older adults in the coming 1 to 2 years, so that area agencies on aging can help incorporate some of these priorities. And, I'll just start off by saying, any service that you're providing to your aging network that you've identified as a priority in your community is one that SAGE shares. So if you're seeing that older adults in your community are needing more access to nutrition programs, to transportation, to care management, those are things that your LGBTQ plus older adults are also needing. As Emma shared in the beginning, we know that many LGBTQ plus older adults are aging alone and may be at higher risk for isolation, and oftentimes have not sought supportive services due to fear of discrimination. And so it's really important that we make sure that our services, that your services that you're providing are welcoming and supportive to our LGBTQ plus older adults. Emma, would you like to share anything? And then we'll open it up to the other panelists.
Yeah, I think what I'll say is one is that there's not always a need to reinvent the wheel. There's a lot of, as we see, there are many people, and there are many more people that are not on this panel that are doing this work and doing this programming. So I mentioned a few options. So we have a program that's called Sage Connect. If you don't want to start your own, it's a national phone buddy program where you call someone weekly. You can also meet up with them in person if you like on your own time. We also have a friendly visitor program as well. There's one in Miami, and there's also ones around the country that are not run by SAGE. So you have this weekly visitor that comes, they help you with some chores. Maybe it's just social time. Maybe it's just sitting, helping sort through your mail. And for a lot of these LGBTQ folks, one of the things that we talk about with our volunteers is that this can sometimes be like the only social interaction that they have all week or all month. And, working with older adults, a lot of us are familiar with social isolation, and it's just that much more difficult when you are dealing with someone who may be estranged from their family of origin, or a lot of their friends and chosen family passed away during the AIDS crisis. We don't have the same services and supports that a lot of other folks have. So having this help through things like friendly visiting programs, through things like Sage Connect, where you have a caller program. I know that there's also a program in Sacramento that has kind of a monthly Meals on Wheels. They have a food truck come, and it's specifically for LGBTQ folks and allies, but it's like specifically like their Rainbow Week. I can't remember exactly what it's called, unfortunately, but it's specifically their kind of Rainbow LGBTQ meal, where a lot of LGBTQ folks can gather, and allies in the community. It's not just for LGBTQ folks. It's also, maybe you have a grandparent who has an LGBTQ grandkid that's very common, or a child. And so I think there's a lot of opportunities in programming that we've seen around the country there that folks are working on. And I'll just do a small plug for networking and learning. Sage has actually recently rewired the way that we partner with organizations in an effort to bring more people in and to be less restrictive. So if you're interested in, being a part of a network of either service providers or advocacy groups or community engagement groups, we can help connect you to other organizations by joining that network. And I'll drop the link in the chat in just a second to kind of fill out that form, but we'll have this service provider group where people can learn about what other programs are happening around the country and say, oh, I think I want to do a friendly visitor program. I'm going to use this article that you wrote about your friendly visitor program and adapt it to my area.
Thank you very much, Emma. Anyone else want to chime in?
I just want to say I'm watching the chat, and some of the things that people are sharing in the chat in terms of resources and various organizations and things is really amazing. So yes, being part of any kind of collaborative is super valuable because we only can, we're exposed to only so much. So
Yeah, it's really inspiring and hopeful to see so many positive things that are happening through our panelists here today, as well as folks that are sharing in the chat. I think one of the next questions that I would like to just ask our panelists to respond to is, and I'm going to kind of paraphrase because there were a couple of questions around this topic area. If you're serving rural communities, how are you doing outreach to reach LGBTQ plus older adults in your rural communities? And have you seen any challenges with that work?
So in Colorado, for Pikes Peak Area Agency on Aging, we have 3 counties, Park, Teller, and El Paso. Park County is more so in the mountains, so it's a very rural, as is Teller. So what I found difficult is, again, identifying LGBT older adults, because like Emma said, we are very good at hiding and very good at adapting and protecting ourselves. So unless I'm actively out there seeking, it's really difficult for me to find and identify. So mine comes through networking through Sage and through partners in Denver, and finding out from them what areas in the community have small little pockets. And if we can identify little pockets, and then it's just kind of going from each pocket to the next pocket to the next pocket and just doing it that way. Because again, I'm in Colorado, we're in the mountains, so we have lots of rural spots that people don't really want to drive through. But yeah, that would be, and then I guess technology, having access to technology, if people had more access to it, it might be a little bit easier and accessible. But then again, coming back to, do I want to disclose that information to people?
And I'll just, from a perspective of working with aging service providers, I can say, I think, again, that training is so important. So providing training opportunities for the aging service providers in your region. So in our region, we do have some urban and some very rural areas as well. And so providing training opportunities for their staff. So then again, they can find out ways to make sure that they're sharing that they're an inclusive organization that can provide care and support is really important. So that's one thing that comes to mind. So I think that can be really helpful. And then I'm also just thinking in terms of for the rural service providers as well, having these kind of trainings where it's okay to ask questions, right? Because it may be a newer training opportunity for some of the service providers in that area. And so making sure that, I think sometimes there can be even a hesitancy or reluctance to ask questions because people don't want to say the wrong thing. And so I think making sure to encourage, hey, come to this training opportunity. This is an opportunity to learn. It's a safe space to ask those questions. So I think that can be something. And of course, whether it's urban or rural, that can be a challenge. But I just think maybe messaging in terms of the training opportunity to get folks at the table to have those conversations, and then to see again how they can begin to identify opportunities to increase the visibility in the community of what they offer. And then again, for us, our local service providers, they're much more knowledgeable about various organizations, community organizations, and things at the county level. And so kind of like Jennifer was saying, finding those organizations, I think it's so important to have those conversations with the people who are right there in that county. So I guess just strengthening the communication about this and how important it is really important in order to reach the people in those counties and in those rural areas. So that's a thought.
Thank you, Katie. I appreciate that. I also want to note, even in our rural communities, maybe you aren't serving LGBTQ plus older adults. Maybe they haven't openly identified themselves yet, but I will guarantee you that you have family members of LGBTQ plus community members who are attending your services. And, so looking at things about, updating policies to make sure that, we treat each other with dignity and respect. And that includes how we talk about one another. I'll just share that personally, my mother was in a setting at her local senior center where other people were making derogatory remarks about being LGBTQ. And my mom spoke up, and she was a true ally in that moment. And, you know, the next week, folks came up to her and they apologized. And so I think it's really important that we recognize that, you know, if there's anti-LGBTQ plus, anti-immigrant, anti-people of color, you know, comments that are happening or jokes that are being shared, this can really have an impact on the people that are attending your services. And the last thing that we want is for anyone to feel like they're not welcomed, you know, in these critical services that are happening within the programs that we fund and support, you know, through the area agencies on aging. And for our next question, I think I'm going to turn to Emma to help with this one. And Emma may have been typing some answers to this one already. But the question is, do we know of any state agencies that have done a self-assessment around LGBTQ plus inclusivity for state plans? And Emma, do you have comments?
Yeah,
there?
and I was typing out an answer, but I'm glad that we get to talk about it as well. So like I said, SAGE has been offering technical assistance to a lot of different states as they work on their area plans on, state and area plans on aging. The ones that were due last year that included some language around LGBTQ plus inclusion are Arizona, of course, now I'm forgetting this way, but yeah, Arizona, Ohio, the District of Columbia, they do their own, Indiana as well. And I'm trying to think of all the other ones. I have them listed, but of course my brain is blanking at the moment. But there are many other, many states, Minnesota, we're also helping with right now on their plan to help draft that inclusive language. So this language exists, and Cheryl also made a great guide with one of the members of the Aging Network in Maine that has some great kind of sample language that you can include in your plan around not just the equity goal parts of your plan, but also throughout the entire plan. So when you're talking about disaster preparedness, when you're talking about home and community-based services, when you're talking about all of those things, just making sure that there's not only an LGBTQ lens, but also a lens for people who are not reaching out to your services. Maybe you don't have a whole lot of Black older adults who feel comfortable reaching out to you. How can we make sure that we're actually like reaching the people who need the services most, who are most isolated and most at risk from, you know, losing their house in a disaster or something? It's just an example. Yeah, there's a lot of sample language for those plans. And then as for the self-assessments and the needs assessments, Lisa mentioned that they did a great one in Missouri. They did a LGBTQ specific needs assessment. I believe it was last year that I can find the link for, where they reached out and partnered with LGBTQ groups to collect information on the needs of LGBTQ plus folks. So there's one in Missouri. I believe there was one in Illinois as well, Jason. And these things exist, these programs have existed across the country, and I'm going to try to find the links to each of them to kind of help find the kind of best practices that people have found from them.
Thank you, Emma. I knew you would have a good answer for that one, so thank you. One of our other questions that came in, this person states that in 5 years of Medicare counseling and fraud and abuse presentations, they've not encountered any LGBTQ plus issues. I realize we are missing a lot of signals. What could we be doing differently? Does anyone have any thoughts on that? And feel free to share in the chat too, folks, if you have thoughts. Lisa.
I might just say this, that good for you for recognizing that, for one. That's a first step. And just the education that is offered through SAGE and elsewhere is helps to sort of build that bridge. And you'll notice a lot more once you start going through those trainings.
And I will say, I'm not sure, but it sounds like SHIP or S&P that maybe this person is working with those programs. And I saw a lot of S&P and SHIP folks on here recognizing some names, but I think that is a good point to also point out that, like, well, Medicare is meant to be for everyone, and so you may not encounter those issues, but it is about being welcoming and affirming. Because when you talk to someone about their benefits, when you talk to somebody about the healthcare benefits that they're receiving, or any benefits, or want to talk to them about trust, etc., if you're able to indicate that you're open and affirming and that you are understanding, then what more can someone open up about? Asking questions about, I have a domestic partner, but we never got married, so we're not sharing health benefits, etc. There are things within it. I'm not surprised you didn't encounter specific issues, but that's almost not the point. It's when you're part of a minority group, you have a different set of eyes, and you can see things that just other people don't. There's history, there's things that you don't always see when you're part of the majority group. And so being able to be affirming just kind of opens the door for somebody to be trusting of you, to let you in, to be more open about, here's my experience, etc. And I guess I would end with, if you're having these reflections, I would imagine you're self-aware enough and self-reflective enough that you're probably doing very well. So thank you for thinking of those things. So.
Any other thoughts from our panelists?
Not for that question, but I did have just one thing I forgot to mention earlier regarding reaching out in rural populations or wherever it may be. One thing I didn't mention is something that we have done is, for any funding that we're administering to other aging service providers, that has like a request for proposal process versus just using our interstate funding formula where they automatically get a certain amount. We have included in that proposal process asking how they are reaching out to diverse populations. And then we also include a quarterly reporting requirement so that it does, it's not just something to kind of respond to in that application, it's something that's at least quarterly, right, top of mind. And so that's something that we have done just to make sure that our network is also aware of the importance of reaching diverse populations, and again, that it's staying on their radar, and that they're able to share those efforts with us. And then we also have quarterly provider meetings where they can then share with each other what's worked and what they've tried. And so getting, again, those conversations going. I meant to mention that earlier.
Thank you so much, Katie. Yes, Jason.
And I'm sorry, I just saw this pop up, but someone asked about LGBT plus veterans. And the VA, please get in touch with your local Veterans Affairs VA. I might say the wrong thing, but so many of them, I think, have to have an LGBTQ plus veteran care coordinator or something along those lines. And we had a great presentation with Thrive, with Pride, about VA care. It is there. So if you have a local VA, do reach out and see if you can figure out who is doing that there. But there are tons of good resources. So I just had to shout that out. I was like, that's a perfect question. Wait, there are. They exist. And those might even just be, if you're looking to do it, just making those local connections, like who's doing this work. VAs are a surprising place you'd find that, in addition to just looking around for where the LGBT plus centers, et cetera, and things like that. And the final thing I'll say that it just came up in a couple of questions is about language and like the letters that are used, et cetera, and how to use language. Sage Care starts here and says that's the fun part of getting to figure out what the letters are. But here at Age Options, we are doing LGBT plus, because when we had community conversations, people in our community were not comfortable with the Q standing for queer, and that was the pejorative term for people in our community. That's not everywhere, but that was to us. So if you are serving people who are maybe Indigenous or Spanish speaking, these are great conversations to have. What are the words? And talking to somebody, if there's people in your community, that's why you want to have those conversations to find out what is the appropriate words I should be using? And it may be this today, and we acknowledge ourselves that the Q will come along eventually, you know, and we might change the language we use, and we're open to it and we're humble. They'll let us know and we'll follow the direction of our community members of what they're comfortable doing. But don't let it scare you. It's just a question to ask and be open about and be humble about and learn from. So, and I appreciate all the comments people were saying about that. So
I wanted to add in on that as well with Jason, because I was one, I'm a veteran, so a lesbian veteran, so I utilize VA services. So if you do, have questions, you can email me. I won't say that I will have the answer for you. I can tell you how I navigate the VA system here in Colorado. The other is I did see some people asking about race and ethnicity and intersectionality, and everything that we're talking about with LGBTQ still applies with intersectionality and race and ethnicity. So every question that you do have that has to do with someone else as an individual and how can we bring that into the community and provide that service, look at it through an intersectional lens or an equity lens. We're looking at LGBT is not just the one piece of who I am. I'm also a veteran. I'm also a woman. I'm also Black. I'm also a mixed race. I also identify as an English woman, so there's various things that are intersecting to who I am as an individual, and that still carries over to your communities that you provide services to. So again, as Jason was saying, is, if you're not sure what language to use, have those focus groups, have those work groups and community conversations with the people in your community, find out what it is that they're comfortable identifying as or using as an identifier. With some of the research, depending on what I'm referring to, I'll say LGB and T, because some people don't want to include transgender with sexual orientation, which is lesbian, gay, bisexual. Some are fine with LGBT plus, some are fine with LGBTQ plus, some are fine with LGBTQIA plus, also LGBTQIA2S plus. So there's various ones, right? It's all about being inclusive. We don't make a big fuss about it. Yeah, we might say, hey, well, why are we adding another letter? We find out why. Okay, we're inclusive, and we move on. And that's how it should ideally work with other programs and resources. So when talking about intersectionality, if you're looking at age, abilities, race, ethnicity, education level, income status, keep that all in your mind when you're asking those questions, when you're talking in your communities, when you're, creating the state plans. All of those are important things to ask questions and keep in mind. And if you are concerned about an inequity that you notice, I always tell people, state it. You ask us to be at the table. You ask to hear our voice. Don't be the one person to quiet that person you invited to the table. Support them, encourage, and continue that education and conversation.
Thank you so much, Jennifer. That was actually going to be the last question I was posing. So thank you for bringing up the importance of intersectionality. It really is something, it's not a buzzword. It's at the core of what we do every single day. So, please keep that at the forefront of your work as you go forward. And I just want to take a couple of minutes and give the opportunity for our panelists to say one thing that if you could, support your colleagues here today, what's one thing they could do to really continue to bring outreach forward in their communities for LGBTQ plus older adults. So quick round. We will start with Katie.
I know I keep saying the same thing, but I'm just going to say again, that training is so important. So I think take advantage of all those links that were popped in the chat box today, reach out to Sage, and that's a great first step.
Lisa.
I would say, don't be afraid to talk about things, to bring things up, ask questions, put it out there. Yeah.
Thank you, Lisa. Jason.
Well, don't be afraid of any question because we've heard it all. So I think of Cheryl leading trainings, and Emma, you guys have probably heard every single question. It's all good. And you're coming with a spirit of learning and et cetera. And then one other just kind of random practical thing, October is LGBTQ History Month. A great time to do some programming that's not Pride, not June. I say that because our Junes here get real busy and there's tons of Pride events. And it's wonderful. What a great thing. What a great thing to have. But we found a lot of great ability to do history programs, particularly intergenerational or different things kind of centered around history. LGBT History Month is in October, so if that's a better time for you, something to think about for programming.
Jennifer, want to bring us home?
Yeah, so I always tell people, ask the questions that are the hardest questions. You know, there's never a stupid question except for a question that's not asked. My thought is, I'm never going to take it as offensive if you're coming at me with the sense of you're just curious and you want the answer, as long as you're not having ill intent and malicious and you're not purposely being offensive. I typically tell people, if you don't have a point person to contact and you have my email and you have a question that happens to fit in my realm, you can shoot me an email. I'm happy to try to direct you in the right area, give you a perspective from my point of view, because then again, I'm not generalizing the entire community. But I don't know all the answers either. So we might just be brainstorming things together, but that's the fun of it, right? It's having that conversation. So my encouragement is, you know, challenge yourself to educate yourself a little bit more on topics, confront those biases, could sit in that discomfort and learn and educate and call it out when you see it.
Thank you so much, Jennifer. And Emma, any last words?
I think all I'll say, in addition to what everybody else said, is that if you come out of this and you feel a little bit overwhelmed with all of the resources and you're like, oh my gosh, I have so much to do. I think one thing that I'd love for folks to do coming out of this is just to do one thing in the next month. At the very least, I mean, I'd love for you to do more than one thing, but if you're gonna do one thing, just do one thing. If that's, you know, looking at your social media, looking at your posters, looking at your flyers, looking at your outreach materials and being like, wow, all of the couples that I have on here are heterosexual and cisgender and white. I'm going to go through them and get some queer people of color on here. And I'm going to actually drop a great link that we have to the chat of some stock photos that are amazing partners in Chicago, Pride Action Tank. And hopefully Nicole will be able to send that to the whole group. They did a great photo shoot. So if you need photos of LGBTQ older folks, you can grab them from that resource and put them in your marketing and things like that. I just want folks to just try to do at least one thing and try not to feel so overwhelmed with, you know, just all of the information that we've shared, because I know it's been a lot.
Thank you for that, Emma, and thank you all for joining us today. We will be sharing resources with you that have been collected in the chat, as well as other resources that we have here at SAGE that may benefit you in your work. Again, this has been recorded, and we will be sharing the recording with you in a link, as well as on the National Resource Center website, so you can share it with your colleagues. If you have any questions at all, please reach out to SAGE. We're here to help you and support you in this work. We can't support our LGBTQ plus older adults across the country without your help. So we really are here to partner with you and be a support to you. So thank you again so much. Jennifer, Katie, Lisa, Jason, Emma, thank you for being here today. And a huge thank you to Michael Adams and Edwin Walker for helping to start us off today. Thank you so much. Have a good week and take care.